Hello, this is Dr. Don Selby. This is Doc Talks, and in today's edition, we're going to talk about depression and understanding the causes of depression. A medical disclaimer that's necessary. We are only going to provide information for educational purposes here. Nothing should be construed or intended for medical advice, diagnosis, or treatment. Do not use this in place of advice of your own physician. If you'd like to make an appointment, we'll give you that information at the end of this presentation. We hear a lot about depression. The rates are going up, and people are depressed about this or that. But let's understand what depression truly is and what it is not. Medically, depression is a condition that negatively affects how you think, how you feel, how you act, how you perceive the world that is around you. This is not just sadness. Sadness is an element, but it's more than just sadness. So we've included here a list of some of the common symptoms of depression. That of feeling sad or irritable, the sensation of emptiness or hopelessness. People who are depressed are likely to have lost interest in activities that they once enjoyed. There can be a significant change in appetite with the accordant weight loss or weight gain. There'll be a change in sleeping patterns, too much or too little, and the fatigue or tiredness that goes with that. They may have a increase in the purposeless physical activity, inability to sit still, pacing, hand wringing. There's no purpose in pacing and hand wringing, right? They have slowed movements or speech. So that's going to be noticeable by others. They're going to maybe feel worthless or guilty about things that they shouldn't feel guilty about. Difficulty concentrating, forgetfulness, difficulty making even minor decisions. And sometimes there's going to be thoughts of death or what we call suicide ideation, even suicide attempts. It's not merely having those symptoms, those thoughts that are important to us, but it's when those occur most of the day, nearly every day, for more than 2 weeks, that we can identify this as depression. There will be a clear change in day-to-day functioning, the performance at work or at school or in their personal relationships. That's depression. Who becomes depressed? Well, it turns out that 30% of adults have been diagnosed as depressed. That's going to a doctor and being diagnosed. 18% of adults are currently depressed. Statistically, women are more likely than men to be depressed. I think that's because women are more likely than men to go see a doctor and be diagnosed. Younger adults are more likely than older adults to be diagnosed with a depression, and I think it's for the same reason. They're simply more likely to go see a doctor. It's important to know that there is no one thing that causes depression. It's multifactorial. So causes of depression, again, are going to be caused by a number of different things. One is brain chemistry. There are a couple of chemicals in the brain. They are called neurotransmitters because they help brain signals or electrical signals to be passed along in the brain. Neurotransmitters, serotonin, dopamine, maybe even norepinephrine. And when you have a deficit of these, you're going to feel depressed. That's all it is. Stress in life can induce this. So loss of a job, loss of something or someone that is important to you, particularly loss of a spouse or a child, even a parent at certain times of life. There are medications that will induce depression. Recreational substances, particularly those that are abused, can induce depression. It's important that we know that hormone deficiencies or fluctuations can induce depression. We think of a mother who has just given birth to a child and she has this postpartum depression, and it's simply because her hormones have not balanced out yet. Genetics can play a role in depression. Genetics plays a role in almost everything, but certainly in depression as well. There are family histories of depression, so genetics plays a role. Sometimes we hear silly or even stupid things about depression. Some people will suggest that depression is a result of mental weakness. They're wrong. Some people suggest that depression is a result of inadequate faith or spirituality. They're wrong. You want some proof of that? I'm not a theologian by any stretch of the imagination, but I know that David the psalmist wrote in Psalms 13, "How long, O Lord?" Read the rest of that passage if you need proof of his depression. He was depressed. In Jeremiah 8 and Jeremiah 20, the prophet there was saying things like, "My joy is gone, grief is upon me." Read those passages if you want proof that even people who are spiritual, relied upon by God to do his work, can become depressed. No one is immune to depression. The purpose here is not to just tell you about depression, but to explain that there is hope. There is treatment. Don't expect depression to just simply go away. There is effective treatment available for depression. You don't have to just live with it. I'm Dr. Don Selby. This has been Doc Talks, an introductory session on depression and what it is and what it is not. If you'd like more information, please go to www.psychiatry.org and they'll have some additional information about depression for you. Thank you.